Alrighty, I'm going to dive right in. Thank you everyone for joining us today and welcome to the Chamber's joint webinar presentation with HR Network Inc. For those of you who I have not met yet or don't know me, my name is Natalie Layton. I am the Membership Vice President or VP of Membership here at the Chamber. I'm actually new to the Chamber, but not to the Chamber world. I come from a background at the California Chamber of Commerce in Sacramento, and I'm so excited to be here with you all. We have an excellent webinar today discussing the latest laws and updates regarding COVID-19 in the last quarter of 2020. So with that, I'm just going to go over some brief housekeeping before I introduce our presenter today. Please note that this webinar is being recorded and will be distributed to our membership and will be available on our YouTube page as well. Please feel free to use the Q&A feature. You can find that at the bottom of your screen, and our presenter, Adrienne, will be able to answer any and all questions at the end of the presentation. And if you want to know more about the membership with the Chamber, please feel free to send me a direct chat. I will put my contact information in the chat as well, and we can discuss that offline. Again, please note that this webinar will be recorded and distributed to all registrants and Chamber members. Now I have the pleasure of introducing today's presenter, Adrienne Adams-Lee. Adrienne is the president and founder of HR Network Inc. and brings over 30 years of human resources experience and expertise from Fortune 500 high-tech companies, including Marriott, ADP, Epson, and Western Digital. HR Network, an HR outsourcing company, was designed to partner with businesses, relieving them of the burden and confusion of the complicated and highly regulated human resources systems and employment laws. So thank you so much for joining us, and I'm going to hand it over to you, Adrienne.
Thank you so much. Welcome everybody. Well, can you believe it? We started out the first quarter with COVID coming in, and we're still dealing with it in the last quarter, COVID going out. So things have changed a little, and some of the laws have changed as well. We just want to keep everyone apprised as to what those laws are, what you need to know as a business, and how to protect yourself and your employees. So let's get going. Okay, so today we're going to cover two new laws that came out regarding COVID-19 and workers' compensation. We're going to talk about the Department of Labor updates to the FFCRA rules and FMLA forms. That's the Family and Medical Leave Act. We're going to talk about working parents and the FFCRA. We're going to look at IRS updates for remote workers. We're going to talk about business travel. Also, we're going to look at how OSHA safe citations that have been occurring. And then we've heard this thing called liability shields. What is it, and how do I protect myself? So, okay, so SB 1159 was emergency legislation that was signed by the governor. And if you recall, earlier in the year, there was some emergency legislation that took place, and it was effective until July 5th. And that was the presumption that if anybody got COVID at work, they got it. Or if anybody got COVID, the presumption was that they got it at work, mostly because the only people going to work were essential workers, and we were all on quarantine. So that was that presumption. They have implemented the presumption, and they are retroing it back to July 5th. However, it's more restrictive than it was before. Now, if you are an employer with 5 to 100 employees, it's only considered compensable if there's an outbreak. And an outbreak is 4 or more employees who get COVID within a 14-day period. If you're an employer with 100 or more employees, it's 4% or more of your employees within a 14-day period. So, for example, I actually had a client who had 5 COVID cases, but it was over a span of 21 days. And so we had to look at each 14-day period, kind of moving the calendar around, and there was never 4 people within the same exact 14-day period. So they didn't have to provide these employees with DWC-1 forms and say it's a workers' comp claim. Now, an employee can still file a workers' comp claim if they believe they got it at work, and you can dispute that. But in this case, if you have 4 or more within a 14-day period, they're saying there's a presumption of compensability because it's now considered an outbreak. Okay, so that's how that works. You are also required to do some reporting as far as COVID positive cases. So this doesn't necessarily mean you have to report it to your workers' comp insurer, but it does not mean it's a workers' comp case. It's just now that every positive case has to be reported to your carrier. So you have to note on there the date the employee tested positive. You don't include any personal identifying information, the date the specimen was collected, that they took a PCR COVID-19 test or an other FDA approved test. Antibody tests are not considered viable. And then at that location where your employee worked, how many people were working there in that prior 14-day period, the highest number of people that worked in that location prior 45 days. So you have to report all your positive cases, regardless if you believe your employee got it or not. It does not create an workers' comp claim. It's just, I don't know if the workers' comp carriers are the ones maybe working with Department of Health to kind of track all these. There's a pretty substantial fine, up to $10,000, if they find that you did not report it or reported false or misleading information. So it's pretty important that you do this. If you have a positive case, just contact your carrier. They have a form. Every carrier has their own form of how they want you to report this information. I just reported one for a client a couple days ago. Very simple. Fill in the blank, send it back. Okay. In addition, for the workers' comp side of this, the employee had to work on or after July 6th. They had to work outside their home or residence at the employer's direction, or if it was in a home because they were providing healthcare services. They had to have taken a FDA approved test, and the test must have occurred during the period of outbreak. So again, remember, outbreak is 4 or more employees within a 14-day window. Additionally, if the claim becomes accepted, the employee is required to exhaust any paid sick leave benefits related to available to them in response to COVID-19. So that might mean FFCRA pay for the first 10 days. And I'm going to review the FFCRA pay again, because that's just something that comes up again and again for employers. Okay, so if you have an outbreak, and if it occurs in the 14-day period, so again, it's 4 or more employees. If you're 100 or more, it's 4%. Also, your place of business can be closed down by the health department if you have an outbreak. And what is a specific work location? It means the building, store, facility, agricultural field where the employee worked at your directions. So sometimes employees may work in different locations, right? I have clients where an employee reports to this office one day, this office the next day. So you may have to track multiple places of employment during their shift or over the 14-day period. Okay, so will these claims affect my mod rate, my X mod? And that is your X mod is your rate that determines your premium. It's really important, right? Because the higher your mod rate is, the higher your premiums. And the answer is no, COVID-19 claims will be excluded from the X mod calculations. Do I have to submit the COVID-19 test reporting form even if my employee is not pursuing a workers' comp claim? And the answer is yes. So that's kind of like 2 different things now, right? One is the COVID positive test reporting, no matter where or how they got it. And the other is workers' comp claim reporting if it's considered part of an outbreak or if the employee feels they got it at work. And remember, the employee feels they got it at work, and you do have potentially presumptions of being able to put it on denial. For example, if the employee tells you, yeah, I was with my Uncle Joe over the weekend and Uncle Joe has COVID, that's where I think I got it, but I'm going to file a workers' comp claim anyway, then you would share that information with your carrier. Or if no one else, you have no other cases of workers' comp, right? That's a pretty good presumption that they didn't get it at work if no one else has it at work. When I submit a positive reporting form, will it create or file a workers' comp claim? And again, no, that's a separate issue. That's 2 different things. I've given you a link here, and this is going to be sent out to everybody, I believe, after the class. So you're welcome to click on this link below to the DIR. They have a bunch of Q&As that are kind of helpful beyond what I've shared here. Okay, so AB 685 COVID reporting and employee exposure. So now, now you've reported it, but you are now required within 1 business day to notify all employees of that a positive case occurred, right? If a positive case occurs with one of your employees, you're required to notify not only your employees, but you're going to see anybody really affected or that came into your workplace during the period of time which they may have been infected. So it requires you to provide a written notice to all employees and the employees of subcontracted employees, anybody who was on your premises during that infection period. And you have to provide them with whatever COVID-19 related benefits they may be entitled to. You also need to notify all employees and the employers of subcontracted employees about your disinfection and safety protocols that you're following, hopefully per CDC guidelines. Your employers may not require employees to disclose medical information. So again, we still have to maintain medical privacy. We have a little more leeway when it comes to COVID. We may share that an employee tested positive for COVID, but we wouldn't necessarily share that employee's name or any private information about them unless the employee told us that was okay, they didn't care. And employers may not retaliate against a worker for disclosing a positive COVID case diagnosis or in order to quarantine or isolate. So I certainly had issues where I've had some employers feel like the employees kind of utilizing the excuse of COVID to say I have to isolate, and that's created some problems. Can I make them go get a test? Can I see the results of their test? And the answer is yes, you can make them go get a test, but if you're requiring them to go get a test, you need to pay for the test if there's any cost associated, and you need to pay them FFCRA pay while they are waiting for the test results. So once you decide, yes, you have to get tested, yes, this is what I want you to do, and it puts that person out of work, then you may be on the hook to pay not only the time, but for the cost of the test as well. The Department of Health and the Division of Occupational Health and Safety, DOSH, has been issuing citations and civil penalties for employers who are not meeting these requirements. And of course, you can see we probably will start seeing claims when it comes to this kind of thing as well. If somebody feels they've been retaliated against, they weren't given work, they were treated differently as a result of having a test. All right, so what do I do if an employee tests positive? And if you haven't had an employee test positive, lucky you. We kind of see as an HR company with our clients, we've been seeing spikes, right? We didn't see any positive tests for probably the first 2 months or so. And, you know, that was kind of like, And then all of a sudden they started coming in, and then they started coming fast and furious. And we were dealing with probably 5 positive cases a day. It did seem to quiet down a lot over the end of the summer months, end of the summer. We are seeing it pick back up again, and I would say we have at least 1 or 2 positive cases a day we're dealing with right now. All right, so what do I do if an employee tests positive? Well, first, if they're still in the building, send them home. 99% of the time, they're not going to be in the building. They're going to call you, I'm not feeling well, and you're going to ask them what kind of, do you have COVID related symptoms? And if they say yes, then they either need to quarantine or they need to go get tested. And at that point, you want to conduct contact tracing. So the CDC just changed. I'm going to talk about contact tracing in a minute, actually. And then you either need to file a work comp claim if potentially it is an outbreak, or provide FFCRA leave benefits to the employee. And I'll talk about that separately as well. Prepare your reporting communications. Remember, now you have to report to all employees and anybody that was in the workplace or in the facility within 1 day of learning that somebody tested positive. And then don't identify the infected employee by name. If you're a small company, people are gonna probably figure out who it is, but you still don't identify them by name in any of your communication. And then follow a cleaning and disinfecting protocol. So conduct cleaning of your facility, close off the area used by the infected person, open windows and doors if you can to help circulation. Okay, so just last week, the CDC expanded their definition of close contact. So previously it was within 15 minutes of being with somebody 6 feet or more. Within 6 feet, spending 15 minutes within 6 feet of somebody who then ended up testing positive. They've expanded that now to say sum total of 15 minutes over a 24-hour period. So from the start of the illness onset. So that's a little harder to contact trace. It's a little harder to, that really expands the definition of close contact, but that is now what is considered close contact. So anybody potentially could be infected if they spent at least 15 minutes or more over a 24-hour period within 6 feet from that person. Okay. So contact tracing, infected people can spread the virus at least 48 hours before the onset of symptoms. So you have to determine who had close contact or shared spaces. You may need to send home those employees who had a risk of exposure and have them maintain social distancing and self-monitoring for 14 days. Now, the CDC early in the coronavirus said, and they still maintain that exposed employees in an essential business can maintain working on site as long as they self-monitor for any symptoms and they wear a face mask. I can't emphasize enough the importance of wearing face masks. We've had a number of cases that have occurred because employees weren't forced to wear face masks. Somebody was asymptomatic. You know, that often happens, especially with younger people, didn't even know they had COVID, and then they end up giving it to a number of other people. You want to keep some form of record of the contact tracing efforts. You may be required to submit that at some point, but again, keep it confidential and separate. And then you can also contact your the state health department. They're actually very good at and can help walk you through the whole contact tracing steps. Okay, so the FFCRA pay was for companies with 500 or less. That has been expanded. So Assembly Bill 1867 expanded it to all employers. So 500 or more now. So pretty much all employers now are following the FFCRA emergency paid sick leave requirements. So I'll go over what those are. Here are the 6 reasons somebody can collect FFCRA. I don't even remember what FFCRA stands for anymore. But it is the sick leave pay that employees are eligible for based on one of these 6 reasons. So number 1, the employee is subject to a federal, state, or local quarantine order. Probably not applicable anymore. It was something that we were dealing with early on when we were quarantined. Not to say it couldn't come back. You know, I keep hearing, I know some that they're tightening restrictions, especially in some of the states where they've had high spikes. Could it come back to California? Only time will tell, right? Number 2, and this is probably one of the number 2 and 3 are probably the most commonly used reasons. The employee's been advised by a healthcare provider to self-quarantine due to concerns of COVID-19. And number 3, to obtain a medical diagnosis if the employee has symptoms of COVID-19. A medical diagnosis is waiting on test results. Okay, so number 2, first of all, early on, tests were not readily available. And because of that, a lot of doctors just said, go home and quarantine. So they didn't get tested. We just had to kind of follow the symptoms. Tests are much more readily available now. So it's likely that a doctor would say, get a test and give them an order to get a test. They go to get a test. And by the way, it generally takes 1 to 2 days to schedule a test and then another 2 to 3 days for you to get the test results back. So that employee may be out for anywhere from 1 to 5 days, just even waiting for test results. And while they are waiting for test results, they would qualify under the FFCRA for paid leave during this time. Now, notice there's a little line there. I'm going to explain why we have 3 at the top and 3 at the bottom. So let's talk about what number 4 is. Number 4 is the employee is caring for an individual subject to an order of above. So I have somebody in my home, my mother, my grandmother, somebody I'm responsible for who's been advised by a healthcare provider to quarantine or is waiting to get tested or waiting on test results, and I have to care for them. And number 5, to care for an employee's child if the child's school or place of care has been closed, or if the child care provider is unavailable. Now, I'm going to talk about childcare almost as a separate thing because it has its own little pieces that go with that. But number 5 is specifically about caring for your child because the child's school is closed or your child care provider is not available due to COVID. And then number 6, the employee is experiencing substantially similar conditions as specified by the Secretary of Health and Human Services. We've never used reason number 6 because unfortunately, the Secretary of Health and Human Services has never identified what substantially similar conditions are. So that's never been one that's actually come up. Now, how does an employee get paid for FFCRA and who pays it? Well, you, the employer, pay it. This is one of those things that the government said the employer is going to have to pay for. Even if you're a small business, you have to pay for it. There is a small business exemption that you can apply for to say that it is just, there's no way I can afford this, but it's only for reason number 5. That's the family emergency leave, which I'll talk about. That's to the right side. So on the left side, we have emergency paid sick leave, 80 hours of paid sick leave. If it's for reasons 1 to 3, it's 100% of pay. If it's for reasons for 4 to 6, it's 2/3% of pay. So let's go back, right? 1 to 3 is about the employee. 4 and 5 is about the employee caring for another, whether it be their child, whether it be somebody that they're caring for in their home that they're responsible for. So if it's for employee, 100% of pay. If it's for caring for another, it's 2/3% of pay. Now, if an employee is caring for their child because the child's school is closed, they are eligible for another 10 weeks of emergency paid family leave at 2/3 pay. This is only for reason number 5. This is only for the child care reason. So what is, oh my goodness, I'm a small business, I can't afford to pay somebody for 10 weeks of pay. You can apply under this reason for the small business exemption to show that it would be a hardship on you. But one thing I want to point out to all employers is you get reimbursed for all monies paid under both emergency paid sick leave and emergency family leave as a credit on your quarterly taxes. So work with your payroll company or your accountant who will set you up to show how to get paid, how to get reimbursed from the reimbursed for the monies you paid out. A couple other things I'll say about this. There's also a form. I can't wait till my quarterly taxes. You know, I put a lot of money out. I don't have that kind of cash flow. The IRS has an emergency or a quick pay type of form you can use to get reimbursed right away. The other thing I'm going to say is when you are paying employees out for FFCRA pay, it needs to be in a separate pay code in your payroll. It is not part of regular pay. So your payroll company will have this set up. They'll tell you how to pay it, what pay code to use, and you need to use that separate pay code because, by the way, at the end of the year, we're now required also to anybody who got paid emergency sick leave or emergency family leave, we have to show it on the W-2. So a lot of information there. Okay, the DOL put out some clarifications on FFCRA leave rules. They actually loosened up the definition of healthcare provider. So, actually they narrowed it. They narrowed who can be a healthcare provider because it was really hard to get doctor's notes previously. Now we use the same definition as you'll find in traditional FMLA, and it's going to be physicians or anyone who can diagnose an employee, provide diagnostic services, preventative services, etc. Somebody who's responsible for patient care. Previously, we told employees that they had to have their documentation prior to any leave they took, but they've changed that rule as well, loosened it up a bit and said as soon as it's practicable. So if an employee says, look, I've contacted my doctor, but they're not getting back to me, we have to be a little bit loose around them getting that documentation to us as soon as they can, rather than before they leave. Another thing to remember is that emergency paid sick leave and family leave is only available if the employee is not available for work that you have for them, right? If you shut down or you have a furlough or you have to temporarily lay a few employees off, they're not eligible for this leave. This is income replacement because they can't work for work you have available. So that's important to remember as well. And then there's this new rule about intermittent leave for childcare. So we were calling childcare leave, especially for parents who's right now some schools are doing 3 days on, 2 days off, etc. Right? So your child might go to school on Monday, Wednesday, Friday, and do then remote school on Tuesday, Thursday. And so we were saying, okay, you need an intermittent leave for this, for your childcare on Tuesdays and Thursdays, and we'll collectively call those Tuesdays and Thursdays intermittent leave, and we'll gather them all up for a total of 10 weeks up to 10 weeks in total. The DOL is now saying that each and every day of leave that a parent needs to take this emergency family leave is no longer considered an intermittent leave. It is a separate leave in each instance. I think the reason that they're doing that is because under intermittent leave rules, both the employer and the employee have to agree about the leave, and the DOL is saying, we're not saying the employer has to agree on this one. We're saying the employee has this it's outright a right of the employee. So maybe that's why they did this. I'm not sure. Okay. Also, the DOL issued new FMLA forms with FFCRA guidance. Now, FMLA forms are for, excuse me, for companies with 50 or more employees. And so if you're less than 50, you're not using FMLA forms. So these links are here and available to you, but please don't go starting to use these if you're under 50, because you might end up having all of a sudden to follow FMLA when it was never even something you had to follow to begin with. So these are just new FMLA forms if you are an employer with 50 or more. And you'll notice there's links on here. So when you get the presentation, you can use the links. Okay, let's talk about childcare related leave. And this one's tricky because every school is doing something different. It's based on what the school district decides. You could have children in more than one school district even. So, you know, it's gotten very tricky for employers. Okay, so what parents choose to do may impact their eligibility for paid leave and unemployment benefits. So the DOL released more Q&As regarding school schedules and paid leave. There's a link there. When you get it, you're welcome to go in and look at those Q&As. They also issued a letter on expanded unemployment benefits under the Pandemic Unemployment Assistance, PUA, which is part of the CARES Act. Remember the CARES Act? That was way 6 months ago. So that might cover, so there might be people who are eligible for the federal unemployment if they're unable to, if they're not unable to get any FFCRA monies. Now, the other thing we talked a little bit about was this hybrid learning format. So parents are eligible for the paid leave on days their child are required to do remote learning, as long as the parent is the only one available to do the childcare. So if there are two parents in the house, you can have the parent sign off. We actually just prepared an FFCRA form. I'd be happy to share it with Natalie. You can send it out to everybody. On where they have to check off and sign off, I'm the only parent available to take care of my kids, and they are required to do remote learning on these days, so I have to have these days off. A person not receiving paid leave benefits may be eligible, again, as I said, for the pandemic unemployment assistance if they're unable or unavailable to work due to the childcare needs based on an online or hybrid format. Now, if the school is, I think this is the next one anyway. If the school is open and it's the parent's choice to send the child to school or do remote learning, and the parent chooses remote learning because they're worried, fearful of their child to go to school, they are not eligible for the FFCRA pay. That's a parent's choice, but they're not eligible for the FFCRA pay. Fear itself is not a reason at all for any of it. Like, we've had many issues where somebody said, I don't feel comfortable coming to work because I'm afraid I could get coronavirus and bring it home to my 80-year-old parent or grandparent who's living with us. That is, unless a doctor says that that person needs to quarantine, that is not a reason that anyone would be eligible for FFCRA pay. So again, unfortunately, when it comes down to fear, that's not a reason eligible for pay. It is a reason, though, to be empathetic and try to work with your employee, and I'll talk about that in a little bit too. Okay, an employee may be eligible if the child's immunocompromised or otherwise at greater risk and can't attend classes, and you can require a doctor's note for that. One thing I'll say is, my children are grown now, so it's not an issue for me, but my grown children have small children and I see the challenges for them, but I also see it just through dealing with all of our clients and our clients' employees. This is so stressful right now, especially for moms who end up taking a lot of the bulk of dealing with this situation. I will tell you that extending some empathy and understanding will go a long, long way. And if you aren't willing to extend any empathy and understanding, you might not lose that employee now, but as soon as this is all over with, and they'll remember how they were treated and how you worked with them on that. So, lots of rising responsibilities of parents, adding additional hours to their already challenging work day. I see a lot of pictures out there of parents with a baby on their lap trying to do Zoom calls. That's real. That is a very real and stressful situation. So we really do encourage you to try to work with your employees and try to come to some understanding or way to help them through this. How can you help employees parents who are working from home? Communicate often and frequently. So often parents are kind of afraid to say what's going on because they're afraid that, they'll get in trouble, they'll lose their job. But if you can be open and accommodating, it goes a long way. Remember, there are mental health benefits typically available. And honestly, you don't have to be a parent to need the mental health benefits right now. Everybody's really struggling with all that we've gone through this year and how difficult the year has been. So if you have mental health benefits as part of your health insurance, remind employees, let them know, tell them what the phone number is. If you have an EP, an employee assistance program, EAP, let employees know about that. Encourage them to take vacation or paid time off, and make sure that you show understanding of how sometimes we just need a break. The other thing too, by the way, is that one of the issues has been nobody did take a vacation this year, so their vacation accounts have been maxing out. What do I do with that? And you might encourage employees, go take a paid week off, vacation week off, and just spend some downtime with your family and relax and recharge, right? You do need to promote the FFCRA, especially if they are eligible for it. Set standards for work-life balance. So instruct your managers and supervisors not to be sending emails, and especially non-urgent emails at all hours of the day or after standard hours, on weekends, etc. Prioritize what are the most important projects you want employees to focus on. You might look at subsidizing even virtual and in-person tutoring services for employees. Boy, that would be a great benefit, right? You could look at job sharing or working part-time. Reduce the number of meetings and who has to attend. I hear all the time, I'm on my 5th Zoom meeting of the day, right? So make sure that it is a meeting that absolutely needs to happen. And maybe if you can't attend the meeting, you can record it for that person, or somebody could take notes and they can kind of share who goes to the meeting and who doesn't. So those are just some ideas. Okay, remote workers. So a lot of questions we've had on who pays the expenses, how are those expenses paid? First and foremost, here's the interesting thing that we didn't realize until we kind of started getting into it. So if you're in LA County, there are different, LA County has a different minimum wage, and then certain cities within LA County have their own specific minimum wage. LA City has it, Santa Monica. I can't remember off the top of my head right now, but let's say you have your office is in Long Beach, but your employee works, which by the way, Long Beach has their own minimum wage order, but it's for hotel workers. But let's say you're in Long Beach, but your employee lives in Santa Monica, or your employee lives in LA, and you're paying California minimum wage. If that remote worker is working out of their home in LA or in Santa Monica, for example, you have to pay them the minimum wage where they're working. So that employee might be eligible for a higher minimum wage than what the minimum wage is at your business location. So you need to be aware of that, where employees are working, and then what other ordinances might apply, such as paid sick leave, because most of the cities who have a minimum wage order have a paid sick leave component of that minimum wage order. All right, what about expenses? So the law says you have to indemnify and reimburse employees for any necessary and reasonable expenses that it takes to do their job. That includes things like cell phone use, using their personal cell phone for work. If they're using their internet at home, that would be supplies at home. So if they are working remotely now, you have to indemnify them for any costs that they may be incurring. Well, gosh, how do I know what to pay them for their cell phone or for their internet use? And the answer is you have to come up with some reasonable amount. So what I call defendable, right? What's a defendable amount? Well, if you think about it, we work 8 hours a day, we sleep 8 hours a day, we have 8 hours a day off on our own. So sleeping doesn't count because we can't use our cell phone then. So we have 8 hours of non-productive time and 8 hours of productive time. That's 50%. So if a cell phone plan costs $50, 50% of that would be $25 a month. That seems like a fair and reasonable reimbursement. And it almost the same amount would probably apply to internet. So my recommendation for most companies is that you're going to be reimbursing about $50 a month per employee for use of the personal cell phone and home internet. Okay. The IRS has the IRS allows reimbursement of cell phone on a non-taxable basis. So whenever you're doing a reimbursement of employee expenses, you kind of reimburse in one of two ways. You either provide it as an allowance, or you reimburse a direct expense. When you provide anything as an allowance, it's a taxable wage, and therefore you have to add it to their W-2 at the end of the year, and you have to and they'd have to pay tax on it. If you provide it as a direct expense through the accounting through your accounting system, then it's not taxable wages. However, it's hard to say that it was not an allowance if it was a flat rate. Well, now the IRS is saying you can provide a flat rate of cell phone on a non-taxable basis, provided you can substantiate the business purpose and nature of the expense. So we've given you information here. Here is a link to the IRS publication on this, and then some rules on the right side of how this works. I do recommend, though, that you speak to your accountant before you implement this to make sure you've set it up correctly. Because if you don't set it up correctly and you and or your employee gets audited and you did it wrong, you might incur additional expense from the IRS and fines and penalties that won't make either of you very happy if that occurs. Just checking the time, see how we're doing. Pretty good. Okay. Business travel is tricky, right? Is it okay to travel now? Is it not? You know, first and foremost, they'll say, if you're going to send people on a business trip, check where they're going first, because again, as spikes occur, states are starting to close up things. They're starting to require self-quarantining again if you come into their state. So you, one, check wherever you might be sending your employees. I would say make sure the travel is absolutely essential. I had to travel recently and I was kind of shocked that both going there and coming back, the plane was completely full. So airlines are no longer leaving the middle seat open. We were in there like sardines. I was very nervous. So I would say make sure that your travel is really essential. Make sure you provide them necessary PPE for travel, a mask, gloves if they want it, wipes, and make sure that anybody exhibiting any symptoms of COVID are strictly prohibited from traveling. As I said, check your state and local travel restrictions. If they're going to be traveling outside the US, again, make sure that they can get into the country and where they're going. But the other thing is make sure they have medical care and check contingency plans should they not be able to get back out. If you note it, if you've seen the news, some of the European countries have spiked again. They're closing down. England's on a home quarantine again. So again, I would tread cautiously, do your research beforehand, and make sure you have a contingency plan for your employees. Okay. Cal OSHA issuing safety citations. So I've had a couple of these actually happen to some of my clients. When I originally created this PowerPoint, they said they had cited 11 employers. They only cited 11 employers, but many employers have been gotten OSHA audits and or a visit from Cal OSHA because they failed to protect workers from COVID-19, didn't take the steps to update their safety plans and properly address hazards related to the virus. 11 employers were assessed penalties anywhere from $2,025 to over $51,000. Every single one of these employers who got assessed these citations were assessed because an employee called in on their employer. And you see this picture on the right. This is an actual billboard that says, "Hey, concerned about your employer not being safe at work? Call in to OSHA. We'll go check it out." And in fact, employees are doing that. Employees are doing, and so one of the things I really, really emphasize to, and I was just talking to a company about this the other day, communicate, over communicate with your employees. People are fearful. And if they feel you're doing everything you can to make it a safe work environment for them, and you're trying to protect them, and you are listening to them, they're way less likely to do something like call Cal OSHA on you. But if they do, Cal OSHA is going to be out there. They're going to tell you that you were, a call came in, a complaint came in, they're going to check you out. Now, one of the things they're going to ask you, and when they get there, is, do you have an IAPP, an injury and illness prevention program? And do you have a COVID supplement to your IAPP? Many employers don't even realize that's a requirement, a law that they have to have that. But it is a requirement, and the IIPP has something like 8 elements. It's really a fancy, very extensive safety plan, right? And it says we operate safely. Here's who's in charge of safety at our company. We train employees to be safe. We communicate about safety. Here are our training records. Here's what we do if there is an incident. So there's a number of things that have to be part of your IIPP. And then the COVID supplement that came out earlier in the year that you are required to have as well talks about your disinfectant and safety protocols that you're following under CDC guidelines. If you don't have one, you need to get one. Where do you get one? Well, we provide those, of course, but I would first call your workers' comp company, your workers' comp insurer. If you're with State Fund, they actually have a template, I believe, on their State Fund website that you can use, but they'll also, I believe, help you. Many of them, not all of them, will help you put that together, okay? So it's not worth the fine and penalty if you don't have one. Okay. Oh, I just talked about all this. Okay, so here is your IIPP, and on the right side is all the things that have to be in your IIPP, right? And it's part of the California Code of Regulations. You have to include who's responsible, how you comply, how you communicate, how you assess any potential hazards. If there's an accident or exposure, how you investigate it, how you correct that hazard, what training and instruction you provide, and then record keeping. So those are the elements of an IIPP. Okay, COVID liability shields. We heard the government talking about these COVID liability shields. I think they were there was federal legislation proposed. It never passed that I'm aware of. It's still out there. But I wanted to, but I've had employers ask me about it, so I just wanted to address it real quick. It is not a get out of jail free card. And it doesn't defend you against any employment claims. It doesn't defend you against discrimination, disability, leave of absence claims, violations of wage and hour claims as it relates to COVID. All that it will do, if passed, is protect you against any tort claims from employees, customers, and vendors who say they were exposed to COVID. So let's say an employee gets COVID, thinks they got it at work, takes COVID home, gives it to their elderly parent or grandparent, and that person gets sick, and hopefully not, but even if they died and they said, we're going to sue you as a company because of chain of responsibility, ultimately you're responsible for my parent dying. That's what this legislation proposed is to minimize those types of claims. But again, hasn't been passed yet, so we're still waiting. We've been waiting a long time on another stimulus package, this proposed legislation for the liability shields. Very hard to say what'll happen in this kind of touchy political climate right now. So we just wait to see, and when we hear it's passed, then we go, okay, let's do a seminar and we'll explain it all to you. So how to protect, last slide, how to protect your business. What are some of the things you can do to really, what steps can you take to try to protect your business and avoid potential litigation? First and foremost, follow the CDC guidelines. That's out there for us to follow. And if we followed it and then still something happens, we have a defense that we did follow as the CDC guidelines for business as instructed. Make sure you're cleaning and disinfecting your workplace. Make sure you're quarantining properly. Use OSHA's most recent guidelines. And again, you see these are links that'll take you to these places to help you with that. For creating a return to work plan. Make sure employees know what measures you're taking. Again, I can't emphasize enough, communicate, communicate, communicate. You might know what you're doing, but if you haven't communicated that, employees don't necessarily know. Stay aware of your employees' health while respecting their legal right to privacy. Keep reminding them what the symptoms are of COVID-19 and the urge to seek medical attention if they experience symptoms. On a side note, I want to jump on that because I've dealt with this a couple times. We're in flu season. Flu season, how do I know the difference between the flu and COVID? And if you go on the CDC's website, there's really no difference. So Well, then do I have to send everybody who may have the flu to get a COVID test? Maybe. I would probably do so to be safe, right? And unfortunately, there's really no difference. All they said on the CDC website is that COVID symptoms last longer than the flu, but that's really the only difference. And, by the time we figure out, hey, this lasted longer, it might be COVID, we could have probably infected a lot of people. So better safe than sorry on that. Err on the side of transparency when informing employees of COVID-19 cases. Well, now you can't even err on the side of transparency. You're now required to notify everybody within 1 day. And then just stay on top of the current and evolving guidelines from CDC, OSHA, DOL, and state and local governments. Okay, so that was a lot of info we threw at you. I know that I saw some questions popping up, so I think Natalie's going to help us and give us some questions, and hopefully I'll have some answers.
Yes, thank you, Adrienne. If anyone has any questions, please feel free to put them in the Q&A box, or you can put them in the chat as well. I do have one for you so far. So when sending the COVID notice to employees and customers, how many days back from the positive test does an employer need to go to notify them?
Well, you have to notify them within 1 business day of finding out of a positive case. Now I don't recall. It was actually in the slide, I thought. I want to say 48 hours, but I'm not absolutely sure. And there was a link to that area, so double check that before you go. So anybody who was in the facility in the last 48 hours.
Perfect. And I don't see any other questions popping up.
Well, good. That means we covered it well.
So I think you did cover it.
All
well,
right.
Thank you so much for joining us today.
Thanks for having me.
All right, and thank you all. And please be on the lookout. This will be emailed to you, and it'll also be on a YouTube channel. Thank you, Adrienne.
Bye-bye.
Bye.